Completely blacked out. #hangover. 1. Alcohol consumption and its effects on the brain. The primary cause of a blackout is the consumption of alcohol. When a person drinks alcohol, it is absorbed into the bloodstream and eventually reaches the brain. Alcohol affects various cognitive functions, including memory, by altering the balance of neurotransmitters responsible for transmitting signals within the brain. This disruption impairs the brain's ability to process information and form new memories. 2. Blood alcohol concentration, BAC, and its impact on memory. Blackouts typically occur when blood alcohol concentration, BAC, rises rapidly. A high BAC can inhibit the proper functioning of the hippocampus, a brain region responsible for forming new memories. The hippocampus plays a crucial role in converting short-term memories into long-term memories, a process known as memory consolidation. When the hippocampus is impaired by alcohol, the brain is unable to form lasting memories effectively. 3. Inhibition of memory consolidation and the role of the hippocampus. As mentioned earlier, alcohol disrupts the process of memory consolidation by impairing the hippocampus. This disruption leads to a failure in storing short-term memories as long-term memories. As a result, the individual experiences gaps in their memory or a blackout. They may not remember specific events, conversations, or actions that occurred while intoxicated. 4. Types of blackouts and their characteristics. There are two types of alcohol-induced blackouts, en bloc and fragmentary. En bloc blackouts involve a complete loss of memory for a specific period, during which the individual is unable to recall any details. This type of blackout can last for several hours or even longer. Fragmentary blackouts, on the other hand, involve partial memory loss, with some details potentially being recalled later. These are sometimes referred to as brownouts, and are characterized by the individual having patchy memory of the events that took place during intoxication. 5. Individual factors and vulnerability to blackouts. Various factors can influence the likelihood of experiencing a blackout, such as the rate of alcohol consumption, genetics, gender, and tolerance. For example, consuming large quantities of alcohol in a short period can lead to a rapid increase in BAC, increasing the risk of a blackout. Genetic factors may also play a role, with some individuals being more susceptible to alcohol-induced memory impairment. Additionally, women are generally more prone to blackouts than men, partly due to differences in body composition and alcohol metabolism. Finally, a person's tolerance to alcohol can impact the severity and frequency of blackouts, with those who have a lower tolerance being at a higher risk. One of the most effective ways to prevent blackouts is to practice responsible drinking habits. This includes consuming alcohol in moderation, pacing oneself, and avoiding binge drinking. Additionally, drinking water and eating before or while consuming alcohol can help slow down the absorption of alcohol into the bloodstream, reducing the likelihood of a blackout. Frequent blackouts can be a sign of alcohol misuse or alcohol use disorder, and it is essential to recognize and address this issue. Individuals experiencing recurrent blackouts should consider seeking professional help, as alcohol-induced memory impairment can have long-term consequences on mental health, relationships, and overall well-being. Chronic heavy alcohol consumption can lead to long-term memory problems and cognitive decline. Alcohol-induced memory impairment has been associated with an increased risk of developing neurodegenerative disorders, such as Alzheimer's disease and other forms of dementia. Additionally, blackouts can put individuals in dangerous situations or lead to poor decision-making, potentially resulting in accidents, injuries, or legal troubles. It is crucial to be aware of the risks associated with alcohol-induced memory impairment and take steps to prevent blackouts. Thanks for watching.